Hello and welcome. Today we're diving into the world of communication disorders, a fascinating and complex area concerning the brain and our ability to express ourselves. Communication disorders affect millions worldwide, impacting their ability to understand, convey, and process information effectively. Join us as we explore the causes, symptoms, and potential solutions for these conditions. Communication disorders arise from a multitude of factors, and the specific cause often varies depending on the type of disorder. Genetic predispositions can play a significant role, making some individuals more susceptible to developing certain conditions. Brain injuries, whether from trauma, stroke, or infection, can directly damage areas responsible for language and speech processing. Developmental issues during childhood, exposure to toxins, and even chronic medical conditions can also contribute to the development of communication disorders. In some cases, the exact cause remains unknown, highlighting the intricate nature of the nervous system. The pathophysiology of communication disorders involves disruptions in the neural pathways and brain regions responsible for language comprehension, speech production, and cognitive processing. Damage or abnormalities in areas such as Broca's area, Wernicke's area, and the auditory cortex can lead to difficulties in formulating sentences, understanding spoken words, or processing auditory information. These disruptions can result from a variety of underlying mechanisms, including neuronal damage, impaired synaptic transmission, or abnormal brain development. The specific pathophysiological changes depend on the type and severity of the communication disorder. Communication disorders affect people of all ages, races, and socioeconomic backgrounds. Certain types, such as language delays and speech sound disorders, are more common in children. Other conditions, like aphasia following a stroke, are more prevalent in older adults. The overall prevalence of communication disorders is substantial, with significant implications for individuals, families, and society as a whole. Epidemiological studies help us understand the distribution of these disorders and identify potential risk factors. The signs and symptoms of communication disorders are incredibly diverse, reflecting the wide range of conditions that fall under this umbrella. Individuals may struggle with articulation, producing speech sounds incorrectly or slurring words. They may have difficulty understanding spoken or written language, following directions, or expressing their thoughts clearly. Other symptoms can include stuttering, voice disorders characterized by hoarseness or breathiness, and difficulties with social communication, such as understanding nonverbal cues or engaging in conversations appropriately. The severity of symptoms can range from mild to profound, significantly impacting daily life and social interactions. Diagnosing communication disorders typically involves a comprehensive evaluation by a qualified speech-language pathologist. This evaluation may include standardized tests to assess speech sound production, language comprehension and expression, fluency, and voice quality. A thorough medical history is also essential, as is a neurological examination to rule out underlying medical conditions. Audiological testing is often performed to evaluate hearing function, as hearing loss can significantly impact communication abilities. The diagnostic process aims to identify the specific type and severity of the communication disorder, guiding the development of an individualized treatment plan. Communication disorders encompass a broad spectrum of conditions. Aphasia, a language disorder typically caused by stroke, impairs the ability to speak, understand, read, and write. Dysarthria, a motor speech disorder, affects the muscles used for speech production, resulting in slurred or distorted speech. Apraxia of speech involves difficulty planning and coordinating the movements necessary for speech. Stuttering disrupts the flow of speech with repetitions, prolongations, and blocks. Voice disorders, such as laryngitis or vocal cord nodules, affect the quality and pitch of the voice. Autism spectrum disorder often includes challenges with social communication and interaction. Understanding these classifications helps tailor interventions to address specific needs. Treatment and management of communication disorders are highly individualized, depending on the specific diagnosis, severity, and individual needs. Speech therapy is a cornerstone of treatment, helping individuals improve their articulation, language skills, fluency, and voice quality. Augmentative and alternative communication (AAC) devices, such as speech-generating devices or communication boards, can assist individuals who have difficulty speaking. Medications may be used to manage underlying medical conditions that contribute to communication disorders. Counseling and support groups can provide emotional support and coping strategies for individuals and their families. A multidisciplinary approach involving speech-language pathologists, physicians, therapists, and educators is often essential for optimal outcomes. While not all communication disorders are preventable, certain measures can reduce the risk. Protecting the head from injury through the use of helmets during sports and other activities can prevent traumatic brain injuries that may lead to communication impairments. Early detection and intervention for developmental delays can improve outcomes for children at risk of language or speech problems. Avoiding exposure to toxins such as lead during pregnancy and early childhood can minimize the risk of developmental issues. Prompt treatment of infections that affect the brain can prevent long-term neurological damage. The prognosis for individuals with communication disorders varies widely, depending on the underlying cause, severity, and response to treatment. Early intervention is often associated with better outcomes, particularly for children with developmental delays. While some individuals may fully recover their communication abilities, others may experience ongoing challenges that require long-term support. Recent research is exploring novel therapies, such as brain stimulation and pharmacological interventions, to enhance language recovery after stroke. Advances in technology are also leading to the development of more sophisticated AAC devices and teletherapy platforms, expanding access to care and improving communication outcomes. There is still much to learn about the intricacies of the brain and communication, and ongoing research holds promise for improving the lives of individuals affected by these disorders.